Hey everybody, it's Dr. Pierce again from Michigan Sports and Spine. So this is exciting. This is our third week in a row, and we actually increased our number of followers, so that's encouraging. We're actually getting more questions. We actually have probably too many questions, my Nicole said, but we're going to try to get through them quickly. So real quick, we're starting to gain momentum on this. Obviously, for patients that have been with me for a while, they know we did the radio show. We're trying to replace this. I actually talked to Dana, if you've listened to my show, the physical therapist that's quite witty and more educated than me. So we're going to try to get her back on, get her information, because so much of what I do is related to physical therapy and active lifestyle, and just that philosophy that it's not just about the physicians, it's definitely not about narcotics, and it's definitely not about surgery to resolve majority of the issues. But when we do need those kind of things, I like to talk to the experts and get their opinion, which we will start doing if we get that type of feedback. So to move into the first question, which has been somewhat of an issue, which I'm worried about at multiple levels, but I have it's a Ford worker. It says, I work on the line at Ford, and I'm nervous about going back to my job that might hurt myself or aggravate what we've already healed. Being out for this period of time, I feel like I've been working out, but have I really worked out related to my job? So what that means is you don't realize the conditioning that you do during your work. And if you take a line worker who's pretty much moving, maybe not heavy objects, but just the stamina of being on your feet for 8 hours a day and working in those conditions, and you haven't been doing that for a couple months, if not longer, it's a conditioning thing that is going to be a big issue. I know I'm going to be seeing a lot of injuries right out of the gate because you can't go from 0 to 100 right away. And what I'm getting feedback is that a lot of these places that are going back to work are doing it with a limited crew, so they're actually increasing your hours so less people are going to be in there. So if you're normally a 6-hour, 8-hour person, you're now moving to a 10 to 12-hour person, and you haven't really been keeping up with your conditioning during this COVID pandemic, you're going to run into problems if you don't find some time to get the conditioning. And one is conditioning just standing, two is condition of the movement. You don't realize that when you're working, you're actually building muscle memory. And with that muscle memory, you get muscle conditioning. But then when I ask you to do yoga and you feel weak with that, that's because I'm asking you to use different muscles. So it's like a catch-22. So you're gonna be like, Dr. Pierce, you're telling me to do yoga, and you tell me that when I work, that's not considered working out. It is and it isn't. It isn't conditioning the core muscles all the time. Sometimes you are working in a position where you are in, let's just give an assembly worker. So you have a routine that you have your set of parts in front of you, you fix those parts and you move it down the line. You're starting. Or guys that are moving heavy pieces of door frames and things like that. I think I've had every type of patient on every line worker. But even like for, everybody's complaining about haircuts and salons and massage people. These people are going to be going back to work, and they're going to be taking care of people that haven't had haircuts in 2 to 3 months. So they're conditioned, especially someone who cuts hair, they're conditioned with their whole upper body and their arms and their neck. If they haven't been doing that, and they have to go back to almost working overtime for multiple reasons, because one, everybody needs a haircut right now, and two, they're going to work longer on those individuals, so that means less breaks. So what's going to happen is you're going to find little soreness, little fatigues, little tendinitis, things in your neck and in your shoulders if you don't prepare. So you have to do some type of conditioning. Now that she's extended it now to June 12th, you guys have some time, but know that the end is near. You can't just wait and think you're going to return to 100%. So the shorter answer is, yes, there is a big issue. I always push that we're always working on prevention. A big prevention thing is you need to find what we call work conditioning. I love that most of you are trying to listen to me about the yoga and doing the core conditioning, but you got to find some work conditioning to get back to. So if you've been sitting on the couch and you've been putting everything off, the day's coming that you need to kind of get into like a full preseason exercise program, warm-ups, cool-downs. Now the question after this is going to be, if I have started work, like some of the people have went back on the 18th, you need to find proper cool-ups and warm-downs. It's not like you're playing a sport, but you got to take some of these labor-type jobs as if it is a sport. So you need to warm up, you need to stretch throughout the day. You can't work an 8 to 10 hour day and think 5 minutes of stretching before you go to work and at the end of the day is really going to resolve anything. You've got to be consistent throughout the day. And if you have issues like that, if you're having a nagging issue, we're now seeing patients obviously by telemedicine, but also we're seeing emergency people in the office, and we continue to build that each week. Don't let this thing go 2, 3, 4 months. Usually my rule is if it hurts more than 2 weeks, you need to get in. And again, if you've had a previous injury, which a lot of my patients, hopefully that are listening, have had, if those are getting aggravated, the rule is if it's painful for 3 to 5 days in a row, you need to get in and be seen and be proactive. All right. So enough on that. Nicole says I need to move on. So question 2. You mentioned alternatives to surgery. What are some of the alternatives to medications? So physical therapy obviously plays a big role in everything I do. Probably 90% of my patients are doing physical therapy, and that's for good reason. What we do is it's a simple 4-step philosophy. Number 1 is you want to reduce the pain. So obviously people who come to me, they're in discomfort. They're not coming for, they got nothing else to do. Everyone who walks in my door has something going on that's either been going on for days, weeks, or years. Like my new patient today, he basically it's been going on for 10 plus years. He's put on disability and it hasn't been addressed. He's complaining the same thing he's been complaining about for 10, 13 years. So to me, that's not a good long-term plan, and it's not about medication. We need to take a step back, make him do things he's not comfortable doing to kind of increase his core work. So to do that, physical therapy is probably not if not number one of the top things that needs to be done. And again, with my system, we have a proven protocols through who I work with. That doesn't mean I have all the therapists or the therapists that aren't in my protocols don't know what they're doing. It's just when everybody's on the same page, that has been very successful in my 20 plus years of practice. I can't have people on different pages, especially when I do injections, either injections into a joint, into the spine, wherever I'm doing. It takes that discomfort away. That doesn't mean that you show up to therapy the next time pain-free, so therefore you can start resistant activities. That's the biggest no-no. And I've talked to a lot of therapists that, they don't see my patients anymore. They can't understand what the program is and the protocol. So what you need to do is deal with a physician, if not myself, who works closely with a therapist or a bunch of therapists, because we have such a wide spread of patients coming from across the state that we have to work with individuals in multiple areas. So at this point, we work with therapists that are like-minded, proven protocols, where we're all on the same page. The basic example is neck pain and back pain. It's a shortcut of conversation because I know the therapists are understanding what I like, and also they give me feedback. You're with the therapist about an hour each time, so sometimes they get information I don't get. So I look to the therapist to actually give me some insight at times too. And a lot of times they'll be like, look, Dr. Pierce, I can't get them better, I can't get them out of the pain. It's probably time for an injection. And that's something that we work on right away. So we're aggressive. Our whole philosophy here is that you need to be playing by Sunday attitude. And for patients that don't like that, they don't stick around too long. So I usually have a more motivated patient population, which motivates me to get them better. So that takes care of therapy. I mentioned the injections. The injections we do, we're always doing it in a safe environment. If you ever have an injection in your spine, you pretty much need an under fluoroscopy or ultrasound is a newer technique. I'm still comfortable with the fluoroscopy over the ultrasound, but in some of these younger, other physicians, they feel more confident with the ultrasound. For me, if I'm going in the spine, I want to be under fluoroscopy, which is like a detailed X-ray, so I can see exactly where we're going. As far as with joint injections, sometimes we'll do it under fluoroscopy, but mostly we do that under ultrasound. It's becoming the more popular. There are studies that shown that the injections in a knee being done under ultrasound had 36% more accuracy, which I think is true. I feel comfortable doing an injection, but improving the accuracy is always better for everyone, and we get to go from there. The other thing that's been going on is a topic that we mentioned is regenerative medicine. So what is regenerative medicine? It's a term that's been being thrown around a lot, and it's becoming confusing, even to the last patient I talked to before I got on here, is, what does it mean? What are we doing? If you've listened to my radio show, we coined it as the whole foods of medicine. It's more organic, all those type of things. What that really means is PRP. So PRP stands for platelet-rich plasma. Platelet-rich plasma comes from your blood. So think about it as we draw your blood, we spin it down for about 20 to 25 minutes. We take out all the healing properties, and we have a higher concentration. So that concentration is somewhere between 10 to 12 times more than normal. And what we'll do is, for a knee, for example, which is the most common, we'll go ahead and re-inject into the knee, and we'll create all that healing properties. So you start getting the healing properties, and what that does, it signals other things in your body to come to, I'm trying to think of simple terms, to come to the healing portion of your meniscus, anywhere part of your knee. And then the other thing is stem cells. So stem cell also comes from your body. It typically comes from your bone marrow. There's also stem cell that comes from adipose tissue, which is your fat. A lot of people like to prefer the fat because they always say take a little extra. That's not really how it works. When we talk about, mostly the highest concentrations are usually in the bone marrow. And we take that from the iliac crest, which is your hip, which has the biggest reservoir of what we call undifferentiated cells. So the undifferentiated cells improve, what they'll do is they'll go into an area, again, call it your knee or your hip, and it'll mimic the cells around there. So what that means is you take these undifferentiated cells in the bone marrow, and we harvest it. We actually do a procedure to take that out, and then what will happen is we spin that down, we get purified stem cells as best as we can. And we talk about cell counts. So cell counts, we don't know exactly what the cell count is. It's a very high concentrated cell count, and then we're re-injecting into that area. So the difference between the two is that the stem cell has the regenerative property. So it's best to do the stem cell if you want regenerative, meaning growth again. And you think of the PRP that has the healing properties. It has less growth factors, but more healing properties. So the simplest way for me to have you think about it is, if you're golf, or if you have we're in the springtime, so you're looking at your grass. So if the grass doesn't look so good, you're going to aerate it, and then you're going to seed it. So that's like the stem cell. And then the PRP comes in, and consider that like the fertilizer. So you're putting the stem cell, and you're putting the fertilizer on, so you already have like a matrix. So once you have that matrix, it gives a better growing position. So for the matrix, what you'll do, that people have asked me, well, is it just one shot and you're done? Well, ideally, we'd like to say that's true, but it's not realistic. A lot of times, we'll have to bring in, like you do your lawn, you don't have to reseed it every time, but you have to fertilize it again. So you're following up with the PRP somewhere 2, 3, 4 months, whatever's working for you. So you want to continue with the fertilizer, and hopefully that's helpful. So we've gotten through 2 questions there. There's more questions coming through. We're going to keep going quickly here. So the next question is, could stress be a contributing factor to my lower back pain, and what can I do about it? So a lot of times people don't realize what role stress is playing And if a physician doesn't address it, and he's just someone who's handing out medications, that may not be the best physician for you. You probably never really want to go to someone that can't listen and take in what we say. A holistic approach is being thrown around a lot. We started a holistic approach since the day I started practicing, so it's nothing new to us. It's something that we've been able to take care of. We're taking on to the patient as a whole. So when you have back pain and it's not adding up and you don't have the red flags of surgical or injections and things like that, we have to ask the next question. So when I'm teaching, especially to my fellows and my residents, it's not like you have to be a psychiatrist or a psychologist, but you need to ask the one more question. You need to ask, what's your stress level at? We're very comfortable asking what's your pain levels at, but are we comfortable asking what your stress level's at? So again, you can just do real simple with the patient, where it's 0 to 10, where, I have people who are like, oh, my stress level, it's 15. Well, that already tells you that you need to address that issue, okay? So if you don't address that issue, you're not treating the whole patient, and you're gonna have an issue down the road. And you may over-treat, and that's probably the biggest thing, is you're gonna get over-treated by pain medications, by procedures, by injections, by therapy, and they just don't get better. You need to address it as a whole. And I'm not saying I have a lot of patients that have a legit back pain with true pinched nerves that stresses come on after. So you have to tease that out. Is it the stress related to the back pain, and then once I take the back pain away, they're doing better? I will count multiple times where we've had a patient where they've just been not the most pleasant person coming into the office, and my staff may have choice words for them, and I may not like them to begin with, but we need to as we reduce their pain, they become some of the most loving, appreciative patients, because we did address their issues, we did get them better, and we did take on them as a whole. So we never try to pass judgment right away of someone who's in discomfort. Like, everyone can contest that they've gone through it, or they know someone that's gone through it, who's just miserable because of the discomfort. Their personality's totally changed, and we get it. We get to meet you on sometimes that day where it's your worst day, you're in terrible pain, you're 10 out of 10 pain, you're stressed because you can't work, you can't provide, you can't lift your child, whatever the situation is. We deal with that, and we take it all into account. We try to be very compassionate that way, and it's worked for us. Am I perfect at it? No. Sometimes I've become kind of like a tougher soul, that I'm kind of a hard ass, that I want to get through it, because I know, like I said last week, you may hate me now, but you're going to love me in 6 months when we get you feeling better. And sometimes the hard knocks is what you need to prove out. So for those people with anxiety, I'm not big on medication. Anybody that knows me, I don't like, here's another pill, here's another pill, here's another pill. I think there's a lot more techniques. If it's not pathologic, meditation has been proven to be great. Yoga, relaxation. I've gotten so much feedback from my patients, from our emails, about the yoga, the meditation, the relaxation, the breathing, the stretching, that they're getting so much benefit from it, that they thought I was a little cuckoo, and then the ones that have tried it, it's actually been proven. Now, my people that are comfortable with yoga, they already know this, so what can you do on top of that? The meditation, you have to have a certain mindset. It's not like clear your head for one minute and you're fine. It's a whole different reset of your body. It's kind of like my daughter accused me of last night. I mean, we went for a walk. It's like, Dad, put the phone away, clear your head, look around, see, we had 2 deers that passed by, and she was right. It was a smack in the face from my 20-year-old daughter. So, sometimes you need someone to call you out that you're not relaxing, that you say, oh, I'm fine. It's that whole next level. Can you get to that next level? And a lot of us don't. And this whole COVID thing, if we can say anything, it's slowed the world down for us. Hopefully a lot of us take a step back. And like we've always tried to do from the day this thing started, is where can we find the positives with all this pandemic? And I think that's one of the biggest ones. The world has slowed down. We're all still alive. We're all still moving ahead. And maybe we don't need all that craziness that was going on before. So the reset point, where's your reset point? And you need to do it for multiple reasons. It's a health reason. I mean, everyone to very wealthy people who just keep run, realizing that it's not important to the person that's just, striving to, I got to impress this person. I got to be at every social event. That's, things you need to address. So you got to see what your stress point is. All right. So question 4, it says, I was notified I'll be working from home for the rest of the summer. I've tried some online workouts, but can't seem to find the ones that suit me. Do you have any websites or online trainers you recommend? So what we've done over the last month especially, is if you're getting our emails, you're going to start seeing I'm putting together what we call the Michigan Sports and Spine Virtual Team. And what that's going to consist of is people doing yoga. We've picked 3 yoga companies. One's Red Lotus, one's Citizens Yoga, and the third one is in Grosse Pointe area. So we're trying to spread it out so we can get people that are like-minded and local and good. We're also picking Pilates because I feel that's a great exercise also. We have Erica Bell with Pilates. And then trainers. Erin Johnson, if anybody's been with me, she's I'm a true fan of hers. She works hard. She's one of those people that doesn't realize how good she is, so she continues to work very hard to make people better. She's been sometimes my secret weapon I've used with patients and some of my high-end athletes to kind of get some of these issues resolved. Meditation's huge. Nutrition, Lisa McDowell works with the Red Wings, we're trying to convince her to join our team. She's one of the most intelligent people I know from a nutritional standpoint. So these are the people that we're putting together, and they're coming to you, and we're trying to organize it a little bit more, but right now they're all available to our patients. We're cross-promoting to each other, and it's not just because of chance. These are people that we've researched out and that I like their philosophy and what they're doing. So definitely get into that. So it said, so the big thing is how many patients are allowed into the office at one time. So I mentioned that we just started seeing patients last week. So right now we're doing it one day a week. We're only bringing a handful of patients in. It's one person at a time unless we're running 2 different rooms. So patients are never in the waiting room. We're doing it where you wait into the car, you're being tested before you're allowed into the building, you pass a screening test, and then you're put right into the exam room. So there's no wait in the waiting room, which some of your patients have made fun that's a real game changer here in my office because it's been a long wait. So we're following all CDC guidelines. There's face masks and gloves are being worn, hands washing, everything's being done. The room's being cleaned, so all that, rest assured that it's not just for us. We're worried about you catching anything from us. My whole staff has been COVID free. There's been no symptoms. We've all been, at least tested, but not officially tested. There's been no symptoms to produce a test yet. That's not available to the people outside the hospital. I haven't been in any of the hospitals. No staff has been in the hospitals, so we're not worried about that. So yeah, rest assured that we're doing that. We're increasing our time frame. We're also doing injections again, which we started last week. We're starting slow because we're trying to get the new rhythm. Everything's taking a little bit longer. Although at the surgery center, I will admit, we're already sterilizing everything. So there's no change there at all. It's exactly what we've been doing. It's just the rest of the world is catching up to our sterilization techniques. So if you've had an injection with me or you haven't, that's not changed much. We're just not allowing people in the waiting room. We're not allowing any people back with the patient. So that's been the biggest change. But as far as the procedure itself, it hasn't changed because it's always been a sterile technique. So hopefully that works for you. We're excited to do this. If there's questions that have come up or people that you want, I've really been promoting, building this up. If this is something that you enjoy, let me know. If it's a waste of your time and you guys don't want to be listening to it, let me know that also. But our goal is to build this up, to get a bigger following, to do it just like we do with the radio show, and be able to answer your questions. So right now I have less restrictions with this than I did with the radio show. So I think this is a great way of communicating. We're enjoying it. My staff's making fun of me again, so they're enjoying this also.
See you next week.
So we'll be back again next week at 3:30 on Wednesday. Tell your friends, pass it around, and give us your feedback. Take care. Peace out.